Hello everyone, this is Chadi Alraies coming to you from RSH 2025 in Riyadh. I'm really privileged to be with Dr. Firas Zahr to talk about mitral valve replacement via transcatheter therapies. Firas, always nice to talk to you, and
Oh,
thanks for
Shadi,
being with us.
it's great seeing you.
Same here. First time in Riyadh for you.
That's first time.
It's my first time also in this conference. Hopefully you're enjoying your time.
It's been a great conference so far.
Yeah.
A lot of content,
Yeah.
a lot of great talks, amazing cases, wonderful speakers. It's been a wonderful couple of days.
Awesome. So now we know TER has been that standard therapy for patient with mitral valve, but however, there's some iteration of new devices for transcatheter mitral replacement. Let's go over, I think this is one of the highlights of your lecture today or during the conference. Let's go over some options and what we have now.
Yeah, it's been an amazing journey. I mean, as we know, TEER is a very successful therapy. A lot of patients with functional and degenerative mitral regurgitation can benefit from this therapy. However, not all patients are suitable. I mean, some anatomy is challenging, MAC, specifically. Also, some complicated mitral valve that is not going to be fixed with TEER. And we know that residual MR for both functional and degenerative mitral regurgitation carries some poor prognosis. So TMVR definitely can help in many of this patient population.
Okay. So this now, what kind of options do you have now? Is it something transapical that's which has been done before, or now we have good options for patients through transseptal?
That is a very good question. I think many therapies has started as transapical. Uh, you know, we like to forget about the transapical option because it's high risk. However, what it did is it actually validated the therapy. It gave us early experiences with the valves, and it solved problems for some patients. But it was carrying a big 30-day morbidity and mortality related to the transapical axis. Yeah. And I think the transfemoral system right now is the wave of the future. And I think almost all the devices are designed for transfemoral delivery, and I think that this is going to be, the future. There are multiple devices that are designed to deal with the variable challenges in TMVR, from LVOT obstruction to fixation to sizing, and right now in the United States there are many devices that are in various stages of development, from finishing the pivotal trials, like the Encircle, the M3 device, way undergoing in pivotal, like the Intrepid, and some of them who are in the early feasibility studies, like InnoValve and AltaValve. So I think the future is very promising, that one of those devices.
I'm going to ask you a tough question. When do you think we'll have something commercially available or available for the operators?
Yeah, I mean, I think we're all hoping for that day to come yesterday, and and I think it's not a secret that there's some level of frustration of how long it take us to get an approved device, but it's been challenging, and even therapy like TEER, it took a while to to take off. It is definitely not like TAVR, although one day maybe I hope that it will be. But we're definitely not there yet.
Okay. Well, again, hopefully it's something coming soon. But as you said, the iterations and the different kind of techniques that's required and the challenges of the anatomy of the mitral valve.
Correct.
Is a big
and
barrier.
imaging.
Yeah.
And we're learning all of this, and we're learning it all at once.
Yeah.
So the future is promising, and I think we have in this conference, just hearing all the talks from my colleagues, it illustrated that we understand a lot more the challenge that we are facing.
Absolutely.
So I'm very hopeful for the future.
Well, Firas, thank you again. Always a pleasure talking to you.
Likewise, thank you.
And watch these videos and others on the YouTube channel, on the website. This is Chadi Alraies coming to you from Riyadh Structural Conference in 2025. Firas, thanks again.
Thank you, Shadi.